Welcome back to Cancer Buzz. I'm your host, Summer Johnson. On today's mini-episode, a remote patient monitoring program to identify and meet patients' needs in real time. Since 2011, the APRN Innovator Awards have recognized APRN member programs, delivering creative and cost-effective solutions to patient-centered care. This episode is part of a Cancer Buzz series highlighting the 2022 Innovator Award winners. Ochsner Health, Ochsner Cancer Institute in New Orleans provides several devices, such as a digital scale, blood pressure cuff, and thermometer, to patients tracking their vitals and symptoms that are then uploaded into the Cancer Institute's electronic health record. The program is called Chemotherapy Care Companion and has successfully reduced the number of ED visits and hospitalizations for oncology patients, therefore decreasing patients' healthcare costs. Erin is a nurse practitioner and advanced practice provider in the Chemotherapy Care Companion program.
This is something that had been in the making, and that we just realized that when taking care of our cancer patients, we needed to offer more and know what was going on more with them. We were concerned about the fact that, sometimes we go weeks without seeing patients, and we're like, what's going on in the interim that they may not necessarily be telling us?
Erin, when weeks go by between appointments, what are some of the things that are happening at home that they may not be telling you?
So the things, of course, we're most concerned about is are they becoming neutropenic? Are they developing some type of infection? Are they having uncontrolled nausea, vomiting, diarrhea, and having these symptoms and suffering at home in silence? This really has been able to allow us to help identify some of those issues and help mitigate them before they come into a big issue.
Would you walk us through what that looks like for the patients as they get connected with the program?
So any patient that is receiving some type of either chemotherapy, immunotherapy, or oral targeted therapy is offered Chemo Care Companion. What it is free of charge, where they provide a blood pressure cuff, a thermometer, and a scale. And this information that they take at home is electronically wired through our system through Epic, and then gives alerts to us if it's above and below thresholds.
Do the patients have to pay anything to go through the program? And then do you recommend every single chemotherapy patient participate?
So good question. This is free of charge for our patients. We've been able to obtain grant funding through this. And so by that, we're able to offer it to every patient who is getting some type of cancer treatment. We offer it to them. There are some people who decline, but we at least get to offer it to them.
And how do you help them remember to do this?
So patients are actually pretty compliant with it. We have people that, who are super engaged. We have people who are not as engaged, but what they're doing is they do get alerts twice a day to remind them about doing so. And then they can also additionally do ad hoc entries as much as they want.
Are you tracking ER visits and outcomes so far?
Yes, we have been tracking ER visits and admissions. In fact, our preliminary data that we looked at says that there's a 33% decrease in admissions and ER visits for those who are active on the program compared to those oncology patients who are not.
What kind of impact has this program had on your own personal day?
I think it's really given me the ability to connect better with patients. There's some people who are always going to tell you everything and report every little thing. And then you have some people who you really have to tug at information because they're scared about, making a dose reduction if you're going to change some of their treatment plan, and they just want the best thing that's available for them. So I think this has been able to help me relate better to my patients and really get a better understanding of what they're going through at home.
Erin, how are the patients responding to the program, and has that changed how they feel about their cancer treatment journey?
I think this has been a huge patient satisfaction win for us. Patients feel like they're more engaged in their care. They're actually getting more touch points with providers because we're reaching out to them if we're concerned about things. And overall, they're better quality of improvement in their symptoms from their cancer. So I definitely think it has improved the cancer experience for them.
If you'd like to learn more about Chemotherapy Care Companion, make plans to join your colleagues at the upcoming annual APRN 39th National Oncology Conference. That's October 12th through the 14th in West Palm Beach. There's more information about the conference and a link to register in the show notes. Until next time, for the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.